Dr. Jonas Apostol.
Alright! Hi guys! So it's month na, grabe! I just want to greet you all. Advance Merry Christmas. Sobrang bilis. So we transferred here at the new building just last month, August 8. So happy Mansari sa amin dito. So we've been doing a lot of smile makeover kaagad. Like, parang wala namang bago. That's what we do every day here. And I just want you guys to like follow us on our social media accounts. We have the YouTube channel at Apostol Dental. We have Instagram at Apostol Dental. Facebook, Makati Dentist by Apostol Dental, and TikTok at Apostol Dental. So if you want to know more about dentistry, you can search our social media accounts. Ang daming cases doon. So we are trying to improve every single day. We are trying to present a lot of cases just for you to be able to relate, and baka who knows, para feeling mo it's sa'yo talaga yung same kayo ng case. So, you know, this might give you an idea, no, on what we are doing here at Apostol Dental. So, yan. Let's go! Let's go to the patient's concern. Okay, so we have this very interesting case. Very complex. Complex. Why complex? Because it requires a lot of specialists just to be able to complete the whole thing. So it's not just me. We have the involvement of our endodontist. We have the involvement of our periodontist. So the root canal expert and the gum expert. Why? Because it's complex. Is it hard? No, but it's complex. So, ito, why very interesting also? Kasi we are always doing the smile thing, right? Pero health kasi yung pinaka-concern namin this time. So we don't go straight to smile transformation without focusing on the oral health. We have to make sure that everything should be healthy, from the tooth to supporting structure and the gums, bago natin siya ma-restore fully. So we are talking about a lot of things. So this patient is a 20-ish female who went to my clinic with the chief complaint of having this anesthetic smile. She's not happy about it. It's because of the thickness, it's because of the color, distribution, symmetry. So that's the reason why she sought my help. So it's my field of interest and my expertise. So I help the patient. But before that, as what I have mentioned, it's always necessary to have diagnostics. So diagnostics is not an option, it's a must for us to get all the details. We are talking about X-ray, we're talking about diagnostic cast, pictures, all images, all angles, no? Videos. We have to check the behavior of the lips whenever she talks, whenever she smiles. That's very important in this field. Also, the most important here is the clinical aspect. We have to check everything. We have to check the patient if she's healthy, if the mouth is healthy, if there's any issues. So with her case, we have found out that there's an infection, dental infection in several teeth. So when we check the X-ray, it's actually root canal treated, but there's a secondary infection we're talking about here. So it requires the help of one of the best endodontist because it's not easy to do retreatment. The sequence for that would be removal of the old thing and clean and do the right thing. It happens, but we are always making sure that all things or all teeth that we restore should be healthy from root to tip, okay? From root to crown, because we are establishing a good foundation here, and we don't want to inflict more damage to the patient if we go straight with the restoration. The root canal treatment had two sessions because it was really intricate and it requires more time with the endodontist to clean all the infection and clean all the canals before we seal it permanently. So medyo matagal. So after 3 weeks, okay na, the endodontist sealed it already. Yay! Good job. But it's not yet enough because we need to do crown lengthening because of the uneven smile, diba? That's what I've mentioned. So medyo we have to also seek the help of our gum expert here. So yun, she did the crown lengthening just for us to give that space in order for the ceramics to be placed strategically. Okay? So after like a week, yun na. We started the restoration process. So, of course, pag pupunta, we need to local anesthetic. That's very important to avoid any discomfort during the treatment. Okay, so removal of old bridge, signing, and everything. So, syempre, we have to be very, very cautious when we do our restoration. Kasi it's not as simple, but it should be systematic. Pero before we do the preparation, I have my wax up prepared already in my laboratory. So the good thing about that is that meron tayong abang, no, for the possible design that would be suitable to the patient. Para hindi siya uuwi na hindi maganda yung kanyang design. So if you look at the view here, the close-up view of the teeth, you can see that there's super bulky upper right canine, which is causing the premolars to look collapse. So that's why we have to make sure also that we balance everything. So the premolars are actually kinda collapsed, that requires additional volume so that we can provide a more symmetrical and more even smile. Porcelain fused to metal bridge are kind of yellowish, so the patient wanted to have a little brighter and natural looking and translucent sets of ceramics. So yun yung prefer ng patient. So of course, we took note of that, and that's what we are trying to give and provide for the patient. Of course, when we do our smile design, it's not just doing some teeth, no, na malalaki or something like this. Dito sa smile design kasi, as you can see here, medyo ano siya, it's not as symmetrical, monolithic, it's too wide, hindi siya masyadong equally distributed. That's the reason why we do smile design, for us to be able to gauge what would be the best for design for the patient, because sometimes hindi siya talaga swak agad-agad. That's why we are doing a lot of modification before, during, and even after the installation of the final. We can also make a bit of modification pa din. So here's the preparation. Medyo, as you can see here, non-vital teeth, discolored na. super yung central incisors, even the lateral. So we are going to have a bit of difficulty when we restore this kind of condition because we are going to conceal the discoloration para it would look natural, no? The choice of material for this case is zirconia, okay? Layered zirconia. Why? Because we can be able to conceal the discoloration. It requires a lot of techniques for us to create a ceramic that would be or mimic the natural sets of teeth. It's not easy because we have to do a lot of staining technique, a layering technique, and also a little bit of manipulation on the tooth structure itself just for us to be able to hide the discoloration.
Several days later.
So after 10 days, 10 days, no, 10 days in the laboratory, because it's not a straightforward case, we needed time to be able to complete the whole thing. So in the laboratory, a lot of things going on, a lot of modification. Of course, for the zirconia, we have our own CAD/CAM machine, which is very helpful just to make sure that everything will blend in. Try-in is a must for us to check the fit, if there's any problem with the design, the color, characterization, if we have to add more, if we have to reduce something. So try-in is a must.
A little longer than a few minutes later.
So after 5 to 10 minutes, patient decided she wants to have the ceramic cemented. So with cementation, we have to treat not just the teeth, but also the ceramics. So when preparing the ceramics, it will take 15 to 20 minutes. When preparing the teeth, about 10 to 15 minutes. So nauna yung ceramics, and then we parang simultaneously sa ngipin naman. The whole cementation process will take like an hour. The color of the teeth, it looks natural with translucency, and with the staining technique, it actually shows natural effect on the ceramics. So yeah, ang ganda. From side to side, it's not bulky anymore. The canine looks awesome. The bite, and that's the most important. Occlusion is very important when we do our smile makeover because it will be the consideration of the myofunctional activity of the mouth. So if we have bad occlusion or mali yung kagat, then it could actually affect not just the teeth, but also the health of the TMJ, the muscles of the mouth, and the gums here. So that's the importance of crown lengthening. As you can see here, we have lifted the gums pataas and added a little bit of volume to make it more symmetrical, well distributed. In this case also, as you may notice, we changed the morphology of the teeth. It's not medyo rounded, kind of flat, that would really mimic the natural teeth, but also considering the facial structure ng pasyente. Binabagay din natin the morphology of the teeth, the size, the shape of the teeth in relation to the face. So to wrap up this vlog, I know most of you would agree that the result is stunning. But it's not about the result. It's about the health of the teeth. It's all about the health of the totality of the mouth, and that's very important. Beauty and health should come as one. a very complex case, yet there's always a solution. That's what we are doing here every day in my practice, to make sure we give the best to all our patients. That is our commitment to the community, to give that apostolified smile, which is healthy, functional, and beautiful sets of teeth. See you guys until our next vlog. Bye!